Neurology, pathology, neurocutaneous disorders. All right, so for neurocutaneous disorders, all that this is that you're going to have some type of, well, obviously you're going to have a neurological deficit, right? But cutaneous is talking about some type of dermatological manifestation that occurs with the neurological deficit, okay? So the ectoderm is going to be involved with either like the skin, the nerves, the eyes, right? They're all derived from the ectoderm. So keep in mind, this is why neurocutaneous disorders can kind of occur, right? You might think it's very odd. Why would you have a CNS disturbance that might lead to also a cutaneous pathology? Well, the reason behind that is because the skin, the nerves, the eyes, they all come from the ectoderm, okay? Now, that's not something that's going to be tested, but just to make it understandable for everyone to be digested, okay, in a manner that makes sense. So let's start off. Number one is Sturge-Weber syndrome. You're probably going to honestly murder me because you probably won't see many questions on Sturge-Weber, but I promise you it comes up like in the randomest times, and I feel like I had like a couple questions on it on my actual exam. Although like I'm not allowed to say that, but like I feel like I did. I'm not sure 100%. But it comes up. So like I want to include it, okay? So first, Sturge-Weber, what you need to know, I'm going to narrow it down to the most important thing. One, it leads to a port wine stain. Okay, so look up what a port wine stain is. Look at it in your book. It's just a stain. It looks like someone poured wine on like our body, like on someone's face, and it's like as if like our skin can get stained with wine. That's what it looks like. Bang, port wine stain. Right? They named it well. So port wine stain. 1, 2, you get glaucoma. 3, you have a brain tumor, specifically leptomeningeal angioma. Okay, and it's going to be on the same side. It's ipsilateral to the port wine stain. So that brain tumor is going to be on the same side as the port wine stain is. Okay, so those are the 3 things I look for. Okay, it's going to be early onset glaucoma, which is like very key. It's going to be so weird. It's going to be like a younger person that has glaucoma. All right, they get port wine stain. All right, and then they'll have brain tumor, leptomeningeal angioma. All right. These patients could have like intellectual disability that might help aid in your diagnosis or differential, but just keep those in the back of your mind. Port wine stain, another word for it is nevus phlemistus. All right. I don't think it's that big of a deal, but they can also call it a capillary vascular malformation. I just want you to know that because they could present port wine stain in so many different ways, and it's so easy. I don't want you to miss Sturge-Weber causing a port wine stain with glaucoma and a brain tumor, leptomeningeal angioma. All right, so just keep that in the back of your mind. Next is tuberous sclerosis. All right, so this is what, once again, that I look for. I look for ash leaf spots. So take a look at what ash leaf spots are. They're not like that easy to differentiate, but you can kind of see what they're talking about when you look up a photo of it. So ash leaf spots. You can see like seizures in the child with ash leaf spots, and they also have hamartomas and angiofibromas. All right, so angiofibromas are, to me, the like most important key aspect. It's like essentially like a bunch of little pimples, although it's like not pimples, it's just like a bunch of little dots, like elevated dots along a patient's like mouth or nasal area. Okay. I swear to you, I have gotten questions on this on very important exams, whether it might be the CBSE, whether it might be like the free 120 or the actual exam. I feel like I've seen tuberous sclerosis with angiofibromas multiple times. Lastly, if you have any cardiac anomalies with tuberous sclerosis, it's going to be common. Okay. So like rhabdomyoma, that's very rare, but you'll see that. All right. So ash leaf spots. So seizures in a kid with ash leaf spots, angiofibromas around like the nose and like the eyes and the mouth, and then hamartomas with cardiac anomalies. All right. And the mom could present with like similar angiofibromas. That's like a key takeaway for tuberous sclerosis. All right. Next is neurofibromatosis type 1. So NFT1 or NF1, honestly, is what I call it. NF1, all right, what you have to know, main takeaways here, is that it's a mutation in the NF1 gene, which is a tumor suppressor gene on chromosome 17. Okay, so chromosome 17 is NF1, all right? And it's a tumor suppressor gene. Now, it's going to have cutaneous neurofibromas that are present, all right? So take a look at what cutaneous neurofibromas look like, all right? Because that's going to be one major sign. And those neurofibromas are made of Schwann cells. They want you to know that, okay? And Schwann cells are derived from neural crest cells. So it all makes sense, right? It all adds up. So the cutaneous neurofibromas are made of Schwann cells, which are derived from the original neural crest cells, which is the peripheral nervous system, right? So good. Next, you'll see cafe au lait spots, all right? And the cafe au lait spots arise from the dermis, right? We already discussed this earlier but it arises from the dermis. Makes sense, okay? So the cafe au lait spots, along with the cutaneous neurofibromas, are very key to NF1, okay? You can also see optic or leash nodules, okay? Leash nodules are pigmented iris hamartomas. So take a look at what leash nodules look like, because there's other pathologies that will show you the eye, and it will have different pathologies, and you have to decide what's going on based off of the image of the eye. So take a look at the leash nodules. They're just kind of like small circular dark spots within the eye, okay? And that's going to be the leash nodule seen in NF1. So those are the three things I look for: cafe au lait spots, cutaneous neurofibromas, and the leash nodules within the eye, the pigmented iris hamartomas, okay? Now, once again, the cutaneous neurofibromas are made of Schwann cells, which come from the neural crest cells, and the cafe au lait spots arise from the dermis. This is going to be from chromosome 17, mutations in NF1, and it's a tumor suppressor gene, okay? It's also called von Recklinghausen disease, and they like to say von Recklinghausen disease has 17 letters in it. Von Recklinghausen has 17 letters in it, and that's how you remember chromosome 17, but to me, who cares, all right? Next is NF2. NF2 is going to present with bilateral vestibular schwannomas. If you ever see bilateral schwannomas, vestibular schwannomas specifically, or bilateral acoustic neuromas, all right, that's another thing that they can say, boom. Anything that's bilateral, like affecting the ear, bilateral acoustic neuromas or bilateral vestibular schwannomas, that's going to be NF2. It's very rare, but if you see it, boom, it's an easy answer, okay? Once again, this is going to be mutation in NF2 gene, which is a tumor suppressor gene, and that's on chromosome 22, all right? So NF1 is 17, and NF2 is 22, okay? Last is von Hippel-Lindau disease, VHL is what we call it. So think about this as a patient that's always in a hypoxic state, okay? So let me take a step back. Let me talk about kind of the genetics first. You have a deletion of the VHL gene on chromosome 3p. So they want you to know that it's deletion on chromosome 3, all right? The deletion of VHL on chromosome 3. So that's the first thing. But since you have deletion there, always think that you are in a hypoxic state for these patients. So since you're always in a hypoxic state in these patients, your presentation is going to be a bunch of things that are very vascular, or they have a bunch of vasculature attached to it, because you have so much VEGF going around trying to create a bunch of different bridgeways to get more oxygen to areas that are needed, okay? So number one, you have hemangioblastomas. Hemangioblastomas are highly vascular, right? It's high vascularity, okay? So that's the first thing you're going to see, hemangioblastomas, all right? And that's going to usually be in the retina. You can see it in the brainstem, cerebellum, but in the retina is usually where they'll ask it. Number two, you're going to see angiomatosis. Angio means blood vessels, right? Angiomatosis is just essentially a cancer of the blood vessels, or just a proliferation of blood vessels. So that's angiomatosis. Number three, you're going to see renal cell carcinoma or clear cell carcinoma bilaterally. And the last one you're going to see is a pheochromocytoma. All right, VHL is very high yield. Once again, it's the deletion of VHL gene on chromosome 3p. All right, you're going to have hemangioblastoma, angiomatosis, bilateral renal cell carcinomas, and pheochromocytomas. All right, very key, very straightforward. I know this page can be difficult and daunting, but everything I laid out here for you, I hope I laid it kind of in a digestible manner, because it's difficult, but you just kind of have to recognize the trigger things and you could get them right on the exam.